It is 8:46 in the morning. The voice of Indiana County, WCCS, AM 1160, 101.1 FM. You can catch the video of our interview with the folks from Westmoreland County Community College online. We'll get it posted here shortly. Right now, though, we want to get to the conversation. And Jennifer Eckels is with us once more from WCCC. And Jennifer, we're talking nursing today.
Yes, that's right. I have brought our head nursing faculty from the Indiana branch. She's going to tell us a little bit about what she does and her experience at Westmoreland.
I called you the Triple M.
That's exactly right.
Mary Margaret McIntosh with us
That's
this
it.
morning. Good morning.
Good morning.
How are you?
I'm doing great.
Wonderful. And how's the nursing program going at WCCC?
Excellent.
Yeah.
Excellent. We just started back last week, almost 2 weeks ago. I have 14 students in my first level, because this is a 2-year program, and 20 in our second level at the Indiana Center. So we're doing extremely well.
Yeah, it's a broad field, isn't it, nursing?
It absolutely is. You can get into just about anything, and I certainly have in my 35 years of doing this. So you can do a little bit of everything, which is nice.
Yeah. So at WCCC, how do we address that? Such a great and expanding field, really. And WCCC is right there helping to train people to get into it. What do we learn at WCCC?
What do we learn? We are a basic education nursing program, so the students will come out after 72 credits and 2 years of full-time study with an associate's degree. They're able to sit for their NCLEX or their National Council of Licensing exam to become a registered nurse. And we give them all the tools, the tips, the trade, the theory that they need to get into the workforce and become a productive professional registered nurse.
And with that sort of a field and the need, there's such a need for nurses, isn't there?
There's an absolute huge need. Between the Bureau of Labor Statistics looked at between 2016 and 2026, there'll be a 15% increase in the need for nursing in this country. So this is a field that you get out, you get a job. Average salary is about $71,000 a year. And as you stated earlier, the field is wide open.
Yeah. Okay, so let's talk about how the program is structured at WCCC. 2-year study course.
Yes.
And what are we learning in the first year? How is it structured for them?
In the first year, which is the year I teach in, they have their very first semester, they have a Foundations of Nursing course. They also have a physical assessment course so that they learn to do head-to-toe assessments. And we have a 10-week professional nursing course that teaches them about the legal aspects of nursing, how you need to be as a student, critical thinking, communication techniques, things like that.
That first year is so key for laying the foundation, isn't it, for the second year and for their entire career?
It absolutely is, and I tell them that their very first day. Everything you learn from the very first day, you will carry on through your entire professional career. So it's not as another course where you might learn the information long enough to take an exam, and then you sort of forget about it. This is something that you learn from day one that you take throughout your life as a nurse.
Those teachers in that first year program, are students, I should say, I said teachers, are those students who are what we think of as the typical high school graduate moving on, or do you mix in more non-traditional students with that group as well?
I have more non-traditional students. I
yeah?
think my youngest is probably 19. My oldest is probably in their 40s.
Really?
I have students that come back. This is their second degree. I've had students that have had master's degrees in the past and decided that they really wanted to be a nurse. So I get a little bit of everything.
And their first degree might not have been anything related to nursing or healthcare at all?
No, absolutely not.
Yeah. So we said it's a wide open field. It's really a wide open group of candidates.
It is, and it makes a nice mix.
Yeah.
Lots of levels of experience so they can help each other through the program, which is very nice.
Now, that first year is going to set them up then for year number 2. When they get to that stage, what are some of the things that they're doing?
In year number 2 is our specialty year. So they do psychiatric nursing, they do obstetrics and pediatrics, critical care, management, oncology, and those are 5-week nursing courses. So every 5 weeks they're going into a different specialty.
Yeah, yeah. I bet you discover among those students that there are some, with every class, there are going to be some who decide, after a while, this really isn't what I'm built for. And it's good to know that now before I move further. But I bet there are some who discover a real passion that maybe they didn't even know they had.
That's absolutely true. You do have students who go, no, not what I thought. And a lot of them are just so jazzed and so excited about what they're learning, what they're doing, because we mirror practical clinical experience with what they're learning in theory. And it is nice for them to be able to merge those ideas, and they really turn out to really love what they're doing.
Yeah. We're talking with Mary Margaret McIntosh from the Westmoreland County Community College about nursing, which she teaches, and of course, Jennifer Eckels is with us, as she has been the last few months, talking about various coursework at WCCC. Jennifer, this sounds like a really exciting field for the college as well as for the students enrolled.
It is. And one of the things that, they really get is that hands-on experience. So, I was just asking her prior to us coming in here, I said, when are the first years starting at the hospital, starting their clinical rotation at the hospital? And she said that next week would be their orientation. So I asked, what gauge the temperature? Are they excited? Are they scared? And she said, a little bit of both, of course. It's a big step for them to start actually going into the hospital and learn the routines and the rounds. So we have that coming up next week, which is very exciting.
Yeah, I would bet, Mary Margaret, that is exciting. But she mentioned that sometimes folks might be intimidated. So to get them into that setting right away, like you are, that must just be a tremendous benefit to them.
It really is, because we've been practicing for the last couple of weeks skills, hard skills like making a bed, giving a bath, transferring patients safely. So now they're going to be able to put those skills into practice. So that very first day, it's a little overwhelming. And then when I start to give them patients the next week, I pair them up. So they have a partner to hold their hand and to get a little bit more settled into the role of the nurse.
Yeah. If somebody has not had experience in a hospital setting for a while, and they get in there and they see the way that the nurses coordinate with one another, the way that they work together for the benefit of the patients, they're going to be amazed.
They absolutely will be. It's a very tight group. Nurses help each other. They want to do the best for their patient. So if one nurse doesn't know something, there's no shame. It's tell me what this is, or show me how to do this, or what do you think? It's a lot of collaboration, not with just among nurses, but between the physicians and physical therapy and dietary. So it's a very collaborative work environment.
Yeah, and I would guess that once you get them in that clinical setting, the ability to work with somebody that's been doing it for a while, it's not like you have to learn tricks of the trade. You have to learn the actual trade, and who better to get that experience from?
That's absolutely right. And I've been very blessed that the nurses at IRMC are very willing to teach my students. They're very good about coming up and saying, oh, do you want to see this? Or, oh, I'll show you how we do this.
Yeah.
And it makes a huge difference to my students.
Yeah, I think a part of that goes back to their training, and probably a lot of them have come through the WCCC program, and so they have that idea of they know what they're going through. They know what a nursing student is going through because they went through it themselves.
That's absolutely right, and I have placed a lot of graduates at IRMC. So it's very nice for me to walk onto the unit, and I know a good many of the staff because they're my graduates. I'd also worked at IRMC many years ago, so I know a lot of the staff, and they are just so accommodating, and they do remember what it's like to be a student.
Yeah. You having that sort of experience as a nurse yourself, I know that the whole medical industry changes so rapidly, but there are certain foundational things that are with you always that a nurse from 100 years ago could step into that clinical setting and could pick it right back up, because those are the sorts of things that it's a timeless profession. I guess that's what I'm getting at.
It absolutely is. You could have a nurse that graduated from a school of nursing 40, 50 years ago, and the technology is very different, but those same basic principles of caring for your client, making sure they're safe, being an advocate for them, certainly is part of our foundation.
Yeah, absolutely. Jennifer, the program, as Margaret said a couple of moments ago, is already underway for this semester. Somebody's listening this morning that says, oh, gosh, I wish I was in that class, but I'm not. How do they get in the next one?
So all they need to do is start off by filling out an application online, and then they'll come in and talk with us. The deadline for the nursing program for next fall is January 12th, so they can submit their application to the nursing program by January 12th, and they could start next fall. And in the meantime, they could hammer out a couple of the general education courses or prerequisites and get that stuff all kind of tidied up before they start into the nursing program. So it's really as simple as just going to westmoreland.edu, clicking Apply Now, and following up with a meeting with the counselor.
Oh, that's a good idea. Before you even get into the nursing program, if you're too late for this fall, which you are, you can still begin the journey
That's
at
right.
WCCC with some of the other required educational formats. Good shape. Good shape. All right, give it the number again. Give the address.
It's westmoreland.edu.
Well, that's easy enough.
That is, yes.
Westmoreland.edu. Thank you so much to both of you for coming in to visit with us today.
You're
Thank you,
welcome.
Tom.
We
Thanks for having
appreciate
us.
It is the voice of Indiana County, WCCS AM 1160 and 101.1 FM.